Hi, my name is Mariah, and this video is tracheostomy care. So to get started for this video, we'll prepare our materials. Today we'll be using a tracheostomy clean and care tray. We will need some gloves and some tape. We'll also be using some normal saline solution and some hand sanitizer. We also have our tracheostomy patient here. So for tracheostomy care, we're going to confirm doctor's orders. We're going to introduce ourselves to the patient. Hi, my name is Mariah. I'm going to be your nurse today, and I've received some orders to perform tracheostomy care. I'm going to have the patient tell me their full name and date of birth. I'm going to check their wristband to compare it for my second patient identifier, along with using the photo on the TAR. I'm going to explain the procedure to the patient. Today we'll be cleaning your trach ties or around your tracheostomy site and replacing your trach ties. Do you have any questions or concerns? Patient has stated no, so we're going to prep the patient. So I'm going to hand wash and pull the curtain to provide privacy. I'm going to adjust my patient and slightly lift their head. I'm going to take my patient's vital signs and also use a pulse oximeter during the procedure to confirm oxygen saturation. I am also going to take off his previous dressings. So for this step, I don't need sterile gloves to remove the dirty gauze. So I'll do that now. And I will just toss right into the trash. Okay. Going to take my gloves off and perform hand hygiene. I'm going to start preparing my patient's tracheostomy care set. I'm going to open my trach care and I'm going to open away from the body and lay down. Going to remove the contents. I will remove the sterile gloves and place them to the side for later use. I'm going to grab my drape and trying not to touch the contents inside, just grabbing the drape. I'm going to open up the drape carefully and I am going to lay the shiny side up. Now with this, I will empty the contents of my sterile field onto my drape. Inside, I have brushes and trach dressings, and I have some Q-tips for cleaning. And I will sit there to the side. I'm going to prepare my cleaning solution, cleaning. And now I'm going to put on my sterile gloves. So with my sterile gloves, I will make sure to keep them above my waistline. Now I will sort my contents here. I'm going to move these Q-tips into a section of my cleaning solution. Okay, and my trach ties. First, we're going to start with removing the tube here. And while removing, we're gonna make sure that we try to avoid from dislodging the patient's trach site. We're gonna place this here in the cleaning solution and let that clean for a minute. After it's done cleaning, we are going to use one of our hands to clean. So we'll remove this from the solution and we're going to clean it. We're going to rinse this out. Once it's air dried, we're going to replace it and lock it in place. For the bristle brush, avoiding the sterile, we can toss it into the trash. I have my Q-tips here that have been soaking in the solution. I'm going to gently clean around my patient's stoma. So I'm cleaning into out and away, and we'll toss it. We'll grab another one and we will clean above it and toss it. And we will continue to clean around until the stoma is all the way clean. Okay, so now that we have this clean, we want to make sure that we have a second person to assist us for removing the trach ties. So with my assistant with two hands will hold down the neck piece as I untie the trach ties. For this video, I will just say I have my assistant. So I will gently untie my patient's trach ties. I'm going to have the patient lift up their head if needed to pull these out. So we'll remove those trach ties. We will replace the ties. And when replacing the trach ties, we want to remember that there needs to be at least 2 fingers of space. And that's to maintain good skin integrity as well as assuring that it's not too loose. So we will tie a small knot to the mask. We are going to wrap around, and you may have to lift your patient's head to do this. Okay. On this side, we will tie and make a knot as well. And along the way, ask your patient how they're doing. Hi, Gerald, are you doing okay? Patient states he is doing okay. So I'm checking on this side. I have about 2 fingers space here. I'm gonna check I have about 2 fingers with the space here, and I will tie. And I'll check that I can get 2 fingers under there, which I can, and it signifies it's not too loose, but it's also not too tight. Now that that's complete, I'm going to place my new gauze sponge here for the patient. So the split gauze will go around and protect the skin integrity for any additional secretions that the patient may have. And we'll change this if it gets soiled and as needed. Okay. So after this, I'm going to clean my mess and dispose. I'm going to doff my gloves, and I'm going to hand hygiene and check my patient's pulse oximeter. Patient is sitting at 98% room air. Asking him if there's anything else that he may need. Patient states no. I'm going to adjust the patient in a good resting position. I'm going to lower the bed and open the curtain.